Good morning, Wallaceburg. This is incredible. For those of you I haven't had the pleasure of meeting, I'm Laurie Marshall, and I'm the President and CEO of Chatham-Kent Health Alliance, and it's my distinct honor and pleasure to welcome all of you here today to the Wallaceburg site. I know that Chief Dan Muskokamon, who is also a member of our board, wasn't able to be here today, but I do want to acknowledge our traditional territories. So let me begin by saying that we are gathered on the traditional territory of the Three Fires Confederacy, made up of the Ojibwa, Odawa, and Potawatomi nations. These nations, known as the Anishinaabe, agreed to share its territory with the British Crown by the 1790 treaty, also referred to as the McKee Purchase Treaty. Today, the Anishinaabe of the Three Fires Confederacy are represented by the Walpole Island First Nation. Part of the Huron Nation, also known as the Hurons of the Wyandots, came to live in the area in 1701. Some Hurons sought refuge among the Anishinaabe and were given a temporary place to stay along the Detroit River in the territory of the Three Fires. Subsequently, many of them relocated to Ohio and then Kansas and Oklahoma. A few remained, but opted to enfranchise in the late 19th century as the First Nation in Canada. The Ojibwa, Odawa, and Potawatomi nations remain in their territory and are now represented by the Council of the Three Fires of Walpole Island First Nation. So this is such an incredible community. And I think before I acknowledge some of our dignitaries that are here today, what I need to acknowledge is that this is a hospital that was built by the people of Wallaceburg, and I would say that its continued existence is representative of this community and what they did to ensure that this organization is going to have a long and storied future in terms of serving the residents of Walpole Island and Wallaceburg and of Kent County. And so, I really want to first begin by acknowledging the efforts of people in this room and other generations who have supported us coming towards today. Today really does promise to be a day for the people, and so I'd like to acknowledge some of our guests that are here today. We're joined by the Honourable Monte McNaughton, who is the Minister of Infrastructure, and we're delighted that this is part of his home riding of Lambton, Kent, and Middlesex. We have MPP Rick Nichols, who is from the MPP of Chatham-Kent and Leamington. We have our MP Bev Shipley, who's here, and we're delighted to have him. We have our Mayor, Darren Caniff, is here today, and joined by Councillors Carmen McGregor. Where's Carmen? There she is, and Darren Hall. And we have two of our board members today. We have Deborah Hook, and we have Betty Shepins that's also here today. And we're also joined by, I think, Gay is there, from our foundation board, and she is the chair of the foundation board, as well as sits on the CKHA board. So we're delighted to have all of you here to join us today. What I would like to do now, then, is turn things over directly to Minister McNaughton. Welcome to Wallaceburg, and we look forward to the news you're going to bring to us today.
Well, good morning, everyone, and thank you so much, Laurie, for that kind introduction. It's so great to be back here at the Sydenham Hospital in Wallaceburg. It's great to see my colleague Rick Nichols, MP Bev Shipley, the mayor, councillors, and so many supporters of this community in this room today. On occasions like this, I think about a joke that our premier likes to make. He often calls me the minister of good times and happy days. And it does always make me laugh a bit. But on days like this, it is certainly true. This feels like a bit of a homecoming for me. I want to thank, first of all, the Chatham-Kent Health Alliance, to all the nurses, the doctors, the personal support workers, all the doctors and all the staff here. Thank you so much for all that you do to look after patients in Chatham-Kent and in this part of the province. Thank you. Our government is truly grateful for all the dedication and commitment. You know, I was at this site almost 14 years ago rallying for what we called SOS, Save Our Sydenham. This hospital, at one point in its history, was in danger of being closed. But a lot of good people came together to voice our concern. They included people like former MP Rex Crawford, people like Jeff Wesley, Pat Davis, there's Conrad, Sheldon, Jerry, Peggy, Bill Pollock. I mean, just so many people, thousands of people from this community rallied to save the Sydenham Hospital. And I'm glad to see so many of those people in this room here today. Today, I have the distinct honor to announce that our government is announcing $500,000 in funding for the Sydenham Hospital in Wallaceburg. This is a planning grant to map out the redevelopment and revitalization of the Wallaceburg Hospital. Today, we are taking a giant step forward in our journey towards a completely remodeled hospital with expanded ambulatory, emergency, and outpatient services. The days of worrying about 24/7 emergency care are over. We have it, and it'll get even better as a result of the funding announced today. Today, our commitment will ensure this hospital will serve patients in Wallaceburg, across Chatham-Kent, across Lambton County for generations to come. I want to give a lot of credit to our Health Minister and Deputy Premier, Christine Elliott, and her Parliamentary Assistant, Robin Martin, as well as my friend and colleague, Rick Nichols, who is as big a supporter of the Chatham-Kent Health Alliance as anyone. And of course, to Laurie Marshall, who has provided stellar leadership to the hospital over the past couple of years. Laurie has been very successful at reducing administrative costs while also adding services. Laurie, you likely won't remember our SOS rallies, but you know a lot about the value of rural healthcare. So on behalf of everyone in this community, thank you, Laurie. And our Premier, Doug Ford, has been very clear himself about his commitment to rural Ontario. Today is yet another proof point. It is also a demonstration that our government will balance a budget in a sustainable, reasonable way while protecting health, education, and other services people hold dear. Because our government puts people at the center of every decision that we make. So you can be sure that the discussion around the Wallaceburg Planning Grant took into consideration the good people of Lambton Kent, Middlesex, and Chatham-Kent. You know, people tend to talk about infrastructure in terms of bricks and steel. The dollar amounts for many projects are so large, most of us can't relate to them. But I know it's all about the people. When we look at projects, myself and my team always ask, who will it help and how will it help them? And I learned this lesson as a young child. My grandfather, Jack McNaughton, served as reeve of my hometown, Newbury, for more than 25 years. His defining legacy was the construction of the Four Counties Hospital. He got it built, and generations of residents of this region have benefited since, and I'm quite proud of that. Although Jack died before I was born, he is the reason why I entered public life, and in many ways, I walk in his shadow to this day. And I'm keenly aware of that as I stand here at the site of a proposed hospital redevelopment. The work that gets done here will help respond to the needs of this area's growing and aging population. I was at an announcement last week in London, and a reporter said it seemed like I was doing one every day. Well, I can tell you, the people of Wallaceburg, that this funding is by far the most important announcement that I have personally made to date. So it's truly a pleasure and an honor to be here today. Thank you very much, and congratulations.
Wow. Thank you. Really is all that I can say. This investment in a planning grant really reaffirms the future of what is our mission. We talk about us being one team, two sites, and what this says is that the government and the hospital are both committed to the long-term future of this site. And I know that everyone in this room really appreciates that level of confidence in us, and we will deliver for you. This really builds on a previous announcement that we had last year of $7.3 million towards the power plant. And that's the first part of the infrastructure that we need in this organization. Everything else requires that level of support. And certainly I invite you at the end of today's festivities to go around, have a look at the poster board so you can see the evolution of what we're talking about in terms of the rebuild and revitalization of this site that will deliver really the hospital that the people of Wallaceburg deserve. I also want to thank the Minister and the Minister of Health and the government for the recent announcement of $1.8 million from the Health Infrastructure Renewal Grant. And what that's allowing us to do, those of you who may have been looking at the outside, we need some new windows. There are some old windows there, some asbestos abatement, things that really are required for us to make sure that we can keep the facility operating while we work towards a new build. Once completed, really this planned revitalization is going to allow us to meet the needs of this community. One of the things that we know, and we do have some of our partners here today from the Local Health Integration Network, is that we're an area of the province that has high rates of chronic disease, things like heart disease, things like lung disease, cancer. We're also surprisingly an area, even though we live in this rich abundance of agriculture, we also don't eat as many fruits and vegetables as we should in the rest of the province, and we have lower income levels. So we know that all of these things actually compound to create a need for care. And we see ourselves at the Chatham-Kent Health Alliance at both of our sites working towards, with partners across the community, towards how do we improve the health of our residents, and this is going to go a long way towards that. So with that, I'd now like to welcome Rick Nichols, who's our MPP for Chatham-Kent Leamington, who would like to say a few words.
Well, good morning, everyone. This is an exciting day. And again, Lori, congratulations, as a CEO of the Chatham-Kent Health Alliance, and of course to the hard-working individuals here at Sydenham. You must be pretty excited about this, right? The answer is yes. Good answer. Good response. Right. Absolutely. This is an exciting day. It's an honor for me to be here with my friend and colleague, Monte McNaughton, the Minister of Infrastructure. It is. I didn't realize that Doug would make those. The Premier would make those jokes about happy days and the Minister of good times. But this is a great time. It's a great time for here at the Sydenham Hospital. I've always been a big believer in small hospitals in small communities, or hospitals in small communities, because they attract jobs. I can remember back in my training development days, used to do a lot of training development, especially in the Wallaceburg area in Chatham and across Canada, U.S., but specifically in Wallaceburg back in the 1990s. And of course, back then, many of you would recall how Wallaceburg was a real booming hub of activity, industry-wise. Unfortunately, we've lost a lot of that, and we've lost a lot of that everywhere in the province. But we're trying to do something about that. But here's the good news, is that, I've been a fighter, Monty's been a fighter for small hospitals, realizing the importance that they serve in their community. Because, if you have a vibrant hospital in a community, guess what that attracts? That attracts business, and business means jobs. And again, you start to get everything rocking and rolling, in a small community. So I'm very, very excited about this as well, about what's happening here. This development, the planning grant is just the beginning. Was it the Carpenters that said, had a song in there? Everything's a song to me, it seems. We've only just begun. And of course, I look at 15 years from now, and this whole area will be just brand spanking new. And of course, I look at it and I say, you know what? I'm glad that our government is investing in Wallaceburg. I'm glad that our government sees the need. I'm glad that our government is investing in my future. Because it's important, isn't it? For all of us. 15 years from now, we're all going to be 15 years older, and whatnot. And it's exciting. It's exciting to see, what, money invested wisely, what it can do for a community and can rejuvenate the community. Monty talked about SOS and how the people in this community, you're fighters, you're scrappers, and you get behind something that you believe in, and you work hard, you fight hard, and here we are now with CKHA, and here we are with the Sydenham Hospital. We've only just begun. And again, I want to congratulate you, Lori, congratulate the community. Keep up the good fight. Keep up the good fight. We need to keep hearing from you because you are the experts. I often say the people that are living, breathing, and experiencing, they're the experts. We're just politicians, And even then I say, no, I'm not. I'm just Rick. But I listen, and Monty listens, and we take your ideas back, and we share them. And with that, we begin to develop plans by working with the experts in the community and getting your ideas and knowing what's best and what you see is best. What's your vision? Not just for today, but as you can see, the final master site here. But you can see how the next stage of development, what that's going to mean. So I'm very excited to be here today. Again, congratulations. I bet you're excited about what this place is going to look like. And you'll still be here in 15 years, right? Wrong answer. No. But at least you'll be able to say, I was proud to work at Sydenham District Hospital, right? Congratulations. Thank you so much, everyone. Congratulations.
Thank you, Rick. We appreciate the passion with which you bring to our community and your acknowledgement of the importance of rural health care and things being delivered locally. I would say the life's blood of this place are sort of standing around me, and I see Dr. Otoy and Dr. Mayo here. There's a number of staff around, and so as much as this is today a celebration of this community, it also is a celebration in this hospital. So with that, I'm going to call on Deborah Hook, who is a member of our board of directors and the chair of our governance committee, and she's going to bring some greetings and thanks on behalf of the board. Deborah.
Thank you, Lori, Minister McNaughton, members of Parliament, federal and provincial, municipal councillors, and Mr. Mayor. Thank you so much for coming. Thank you to the community for coming. This really does, as a board member, make us feel that the work that we do on everyone's behalf important and enriching and is invigorating when we sit around the board table and discuss issues. So on behalf of myself and the fellow board members, I would like to express my gratitude to the government and the Ministry of Health and Long-Term Care for today's significant announcement. A special thank you to you again, Minister McNaughton, Minister of Infrastructure, for making the trip back home to your roots to share this wonderful news with us today. It's been a pleasure to host you, to have you help you visit the hospital and share the exciting plans that we have in store. Today's announcement of the planning grant reaffirmed the government and our commitment to program and service delivery at our Wallaceburg site. As Lori mentioned, we are keeping momentum going for redevelopment. Over the past 2 years, our renewed focus on this site has been reinvestment in the emergency department, additional respiratory therapy coverage, capital equipment upgrades, the addition of specialty clinics, and a partnership to provide community care nursing clinics. All of these departments and activities set the stage for the reinvestment we are seeing from the government to ensure that hospital services remain an important part of this community. A well-functioning community hospital helps ease the stress for its patients by offering high-quality care, and we get high-quality care at this hospital. CKH's Wallaceburg site is a healthcare hub for many residents in Wallaceburg, Walpole Island, and the South Lambton area, making today an important milestone in reaffirming that this site will continue to serve the needs of rural Kent. So once again, thank you, Minister McNaughton, for joining us today and sharing this wonderful news on behalf of the Honourable Christine Elliott, Minister of Health and Long-Term Care. Thank you.
Thank you, Deborah. So that brings our festivities to a close. I will invite the members of the media to join the speakers just outside in the hallway for any interviews or photos and conversation. Invite the rest of you to please enjoy each other's company. We do have refreshments over here. Today really is a celebration, and so please take the time to celebrate. Thank you, everybody, for coming.